resource library. You'll also get a letter of recommendation and a practice exam. Diploma in Child Health. In a country where pediatric care is critical, the DCH Prep program equips you with accredited competence across neonatology, infectious diseases, nutrition, emergency medicine, and more. It's designed to bridge the gap between med school and specialist pediatric practice. Diploma in HIV management. For doctors working in primary care, CHCs, or district hospitals, our HIV diploma program offers expert-led preparation across all 27 professional activities with case-based MCQS, data interpretation, and ongoing clinical updates, all within a supportive peer community. And we're excited to introduce 2 new additions to our diploma preparation family. Developed in response to your needs and aligned to the latest CMSA requirements, Diploma in Anesthetics. After years of fragmented prep, our intensive 12-week anesthetics program brings structure and support. With 72 contact hours, 2 expert-led sessions per week, and content aligned to 25 CMSA core topics, you'll be learning from senior DASA diplomates committed to safe, quality anesthesia care. Diploma in Ophthalmology. General practitioners can now better manage eye conditions through our ophthalmology prep program, covering clinical diagnosis, emergency management, pediatric and adult conditions, and practical OC preparation, all aligned to CMSA standards. This is more than just exam prep. It's professional development with purpose. Registrations are still open. Visit clinicalcareplatform.com and take the next step in your career today.
Good evening, colleagues, and thank you so much for joining us this evening. And thank you for making time just so you be with us in this information session. My name is Releboga Monedi, and this is the face behind the calls and the emails, and I am the billing and finance lady for the clinical care platform. And I just wanted to so that we can see who you speak to and who sent emails and make calls. And thank you. And welcome to this evening information session. We will be giving feedback session based on the Diploma Preparatory Program survey that was published on the 1st of September. It's a 10 questions survey, and I am not alone this evening. I'm with Imelda Nhleko, the customer support specialist, and the amazing lady will be taking you through the feedback, and I will be going through the housekeeping rules. Please note that this session is being recorded and the info session is not CPD accredited, so we do not have CPD points for the information sessions. And please share questions via the Q&A box. If there's anything that you need to know, and you can just ask on the Q&A box and we will definitely answer. And again, if time allows, we will take a few live questions at the end. And you can also send us an email for any inquiries at info@clinicalcareplatform.com. And you can also comment on the chat bar just at the bottom of your screen. And thank you. And what we are looking forward to this evening, opening and welcome, and also the survey results, basically the feedback from the survey and insights, and also the planned program improvements And at the end of the session, we should time allow, as I have said, and we will go through the Q&A and yes, and again closure. And up next, I will be handing over to the amazing lady behind the customer care support, and she will be taking us through the feedback from the survey that was issued. And I will be handing over to you, Imelda, and thank you so much.
Hi, can you confirm that you can hear Imelda?
I think she's muted.
Sorry, I didn't unmute. Sorry about that. Yeah, Kivita Mang has just also alluded that I had not unmuted. Good evening once more and welcome. My name is Imelda. Can you all hear me clearly and see me clearly? Just for confirmation.
Yep.
Okay, thank you so much. I'm from the Customer Support Division, and we are grateful that you took your time to join us today. This is a feedback session, and we find it valuable post the survey that we published, shared with you at the beginning of September. And we had 10 questions to the survey that the purpose of them was to understand your experience with the diploma coaching programs that we are offering, and to also identify what works, what you enjoy, what you appreciate from them, which areas we needed to improve on, and to also ensure that the experience in terms of the next cohort or offering of the diploma preparatory programs covers the experience that you need and the areas of improvements that you have mentioned on the survey, and also to ensure that at the end of the day, those who sit in for their exams actually do pass them. And we understand that some ideas may not come from the boardroom or from us as colleagues sitting together, but from talking to you, asking you, the participants or the recipients of our offerings, in terms of what is it that we can offer you or cater to you. So thank you. Moving on to the next slide, please.
Hi, Amy.
So in terms of your participation, yes, Dr. Mawela?
Yeah, you can switch off your video because sometimes you cut. So I'm not sure whether it's the network or maybe it's on my side. Then maybe during the Q&A, you can switch it on back again. Yeah, thanks. You can slow down. You can slow down as well.
Not a problem. Okay, then. So yeah, in terms of the 10 questions survey that we shared, it was a mixed survey in terms of qualitative and quantitative responses. 46 participants took their time to respond to the survey, and you honestly gave us your feedback. We wanted to do this in terms of it being a mixed methodology type of survey, just to ensure that we have the numbers and the information all together to improve better in terms of the next offerings of our diploma preparatory program. So as I've mentioned, 46 of you took your time to respond to it, and you actually completed it. So that gave us 100% completion rate. We appreciate that. Thank you so much. And of the 46, 43% went as far as giving us the qualitative feedback in ways to tell us what you enjoyed more and what you'd like for us to improve on. We truly appreciate that. And we did this from the offerings that we had in terms of our programs. Previously, we had HIV diploma preparatory program. So the numbers there show the number of people of the 46 that participated, from which diploma program they're from or which they uptook. And in terms of obstetrics and gynecology preparatory program, we had 13 participants. Internal medicine, we had 8 of the 46 that participated, and our diploma preparatory program in child health had 6 of the 46 participants. So this is the overall statistics of the program's offerings. And in overall, we asked you how you felt, what you enjoyed the most, and what you'd like for us to improve on. And you honestly said our offering was excellent. Our facilitators did a great job, an excellent job. And 13 of you said it was good, there's room for improvement. And one participant said it's average. And in terms of poor, because our questions had 5 multiple choices that you needed to select from, one participant said there's a lot more that you need to improve on, and none of you felt it was very poor. We do appreciate that. And in overall, we got a 67% when you put the numbers together in terms of your overall experience, in terms of it being an excellent offering. And in all these numbers, we are taking them into consideration for improvement. And our question that followed in terms of question 3 of the survey, we asked our participants who actually sat for the exam, because we understand that not everyone who registers for our preparatory programs registers with the intention to write the diploma. Some of you do that for clinical knowledge, confidence, and upskilling yourselves. And of those that responded, 72% of you actually wrote the exams, and 28% have not yet written. We are here because we have continuation programs and to support you whenever you're ready to take your exams. And from these numbers that we've reported to you based on the question, the overall percentage of the participants who sat for the exams was 93% pass rate. Would like to congratulate everyone who sat in for their exams, and the 6.9% that didn't do fairly well, we are still here. Continuation programs are available with improvements based on the feedback that was shared. We'll be improving, and we are here to support you. You'll fall through the next 100% pass rate, because that's what we are aiming for in the next cohort. Congratulations to everyone that partook in their exams for the diplomas. So in terms of the qualitative responses, as I mentioned, you asked what you enjoyed the most. Yay, thank you. We asked our participants, what is it that they love the most in terms of them giving us an excellent average net promoter score, if I can put it in that manner. You mentioned that you love the quality of our content and how it's instructed. So that goes to our facilitators as well. In that, it encompasses that we share with you past exam-based preparatory questions or resources. Our content is up to date in terms of the guidelines that we use. Our facilitators or instructors are experts in the field that they are presenting on or facilitating in terms of the diploma preparatory programs, and that it is comprehensive and it covers the syllabus topics that you actually sit in and write on during the exams. Another point that you highlighted also was that it was interactive and in an engaging format. So with the live Q&A sessions that happen during our coaching sessions, you appreciate that, and that our instructors or facilitators are approachable because they avail themselves through our support groups. We have emails, WhatsApps, where you're able to write questions, post questions on there, and you find that our instructors are approachable and they have assisted you a great deal. And the clinical case discussions that go on post the coaching sessions on the WhatsApp groups, you appreciate them as well. You find that they are practical and they are applicable examples that have actually assisted you in writing your exams and in your clinical application on a day-to-day basis. And the other point that you put was that it was practical in terms of the application. So not that it only helped you to pass the exam, but you are able to come back and implement it in your workplaces clinically, and it's beyond just the exam preparation. It helps you with your day-to-day work. The examples, content guidelines are also evidence-based. They refer to the guidelines that guide us in terms of the day-to-day work that you do as healthcare professionals, and that you've seen improvement in the patient care delivery and that you're confident now. So that's what you've appreciated and loved the most from the coaching sections that we have offered previously. So we'd like to appreciate you for this feedback. We are taking it into consideration and we'll work more on this to ensure that we still keep the baseline as is and improve more based also on the information that you provided. Furthermore, we'll move on to the next slide. And then not only did you say we're excellent, you did say we need to improve on some areas. And here you did detail what is it that we needed to improve on. And we appreciate this a great deal. So in terms of time management, as Dr. Malay said, slow down. So I was pacing myself to say I needed to ensure that we finish on time, appreciating that time is very crucial given the diverse work schedules that you have. And we understand that our sessions sometimes can overlap over the scheduled or repeated time because there's a lot more that needs to be covered, and our facilitators feel the need, they need to cover everything so that when you sit in for your exams, you are well prepared and confident. Therefore, our schedule, our sessions overlap. We took that into consideration. We respect your feedback, and that you felt that the content was now then rushed due to perhaps the time frame that the facilitators may be given during the coaching sessions. And you felt that with some topics or syllabuses, there wasn't enough time allocated to them, and that we need to look into that certain topics perhaps needed more time on there to be covered. And you also alluded on the learning materials that we offer, because there's resources that we also share during the period of your preparatory program enrollment. You've requested that slides be made available for download. However, we are unable to do this due to intellectual property. We'll also touch base on that on the other slide that's coming up. And you also requested that we better organize the recorded sessions onto the libraries, because each preparatory program has its own library wherein you can recap on the previous coaching sessions. And if you are unable to, due to work commitments or other commitments, we make the recordings available for you. You then requested that if we perhaps can put them in some order that would make it easy for you to sift through and find them with ease. We've noted that. And then you needed more written materials, guidelines, resources, SOPs, and the likes. We've noted that. And that follow-up support post the sessions. As I've mentioned, WhatsApp groups are available. Sometimes perhaps for some participants that wouldn't be enough. We are looking into other ways that we can extend support to participants, and also the revision materials in terms of us sharing them perhaps earlier on into the program instead of towards the end of the program where you'll be actually sitting in. So we'll make those mock exams, question papers available to you early on into the program. And also the quizzes that we also share, because we have polls that we put up, quizzes that we put up that pertain to the actual exam. You have requested that we put them up early. We have noted practical preparation, more past papers, additional practical skill sessions, and case-based questions, which you appreciate, as you've mentioned in the earlier slides. CPD points clarity. You requested that we explain better and more in terms of the CPD points accumulation, because as for example, this info session is not CPD accredited, and that would apply to some of the coaching sessions that you'd attend. And from there, how do you then accumulate the necessary CPD points that would qualify you in admission with the CMSA to sit in for your exam? You wanted us to clarify that for you. We will be doing that during the Q&A, and also clear instructions in terms of the self-paced sessions completion. So we will be making that clear for you in terms of the CPDs, that you need to complete a minimum number of minutes to qualify to getting the certificate, and the CPDs allocated. We will be responding to that in more depth during our Q&A. Thank you very much for these pointers. They are key to us improving on the next intake or offering. And we ask you in terms of our instructors who dedicated their time, valuable time, to participate in these offerings, which we are appreciative of them very much so. We had Dr. Mawela in the offering of the Diploma in Child Health Preparatory Program. We had Dr. Ryan in internal medicine. We had Dr. Magagula, who's also a specialist in obs and gyn. We had Dr. Levine in the HIV preparatory program. We appreciate you. Thank you so much to our instructors. And what you said you love the most about them and their facilitation is that they are clinical experts, and their examples of real world examples or practical examples that you can relate to and apply. You found that they are approachable and interactive. they impart so much knowledge that gives you confidence and also have allowed you to be able to sit in for your exams and actually write and pass them. And their enthusiasm, as they differ in terms of how they present and share knowledge, you love their enthusiasm and practical teaching styles, and that they have made complex topics and accessible. So to our facilitators, if you're here tonight, this is to you. Our participants appreciate and find that you have helped them a great deal in their preparatory program. And we also thank you as CCP. And we asked you to say, be our voice out there to your peers, your colleagues, and the likes. And in terms of that, would you be willing to share testimonials to encourage others to sit in for the exam? Because there could be a participant who's here having registered for the preparatory program. They need more information, they need confirmation or a testimony from someone like you who has already said and written, and guidance and advice in terms of how they can go about it. And you said yes, you are more than willing to give us testimonies, provide us with feedback that we can then share with the public. This is important, that we build a community that of empowered clinicians through the information that you'd have shared as testimonials, and also with the feedback that you've shared that it's improving on patient care. So these diploma programs help you in terms of improving on the care that you provide to our patients on a day-to-day, and that you are empowered as a clinician. So I'd like to thank you, so to send a thank you to the 20 members who have actually provided their details. But the following question was, can you provide us your details so that you can send us your testimony or advocate for these programs, so that other colleagues can feel empowered and at ease to enrolling in the next cohorts as registrations are currently open. And with that, not only did we listen, we have taken action, we are taking action, and we continue to take action on your feedback in terms of time management, as coaching sessions will be starting from next week with the different diploma offerings. Time allocation, we have taken that into cognizance, the start and end time as well. The session schedules, they have been shared on WhatsApp groups. If you're not there yet, we will be sharing the email with you to join the WhatsApp groups. Schedules are out. Study materials, downloadable resources, slides, as alluded before, for intellectual property reasons, they will not be made available for download. However, they will be there in the resource library for each program for you to be able to review and revisit anytime that you'd like to. And we will reorganize the resource libraries with every material or activity that would be taking place, and we put up there. And our sessions recordings will be labeled clearly and made accessible to you on time, and will communicate through the various platforms that this session has now been uploaded. You can access it here and share the direct link with you. In terms of practical skills development, as you've mentioned, we will be hosting OSCE exam mock exams as well throughout the period, not just at the end. And also question banks, we will be sharing those in different intervals throughout the program. And you also mentioned that you need it to be exam aligned in terms of the integration with the CMSA weekly objectives. We've taken that into cognizance. Past paper, question papers, we'll be making them available, and we appreciate that. And you also mentioned that or advised or recommended other areas that you'd like for us to expand on, or other offerings that you needed for us to share. We are happy to announce that we are now offering a diploma preparatory program in anesthesiology and a diploma preparatory program in ophthalmology. Based on your feedback, we are already actioning it. It's part of the cohorts that are open for registration. And in terms of emergency medicine, it's upcoming. We are launching that, and other offerings that we are also looking into that are upcoming. So watch this space. We are expanding more and growing more to ensure that all healthcare professionals are accommodated in terms of the diploma preparatory offerings. So this is the feedback that we have actioned and continue to. We wouldn't end this without the true stories that you have shared with us, and we felt how best to share them instead of using your real words in terms of what you have said. we weren't able to take everything. We just picked and choose that due to time. You said your clinical skills have improved significantly. The coaching sessions were excellent, up to date, and they gave you the exact information that you needed to sit in for your exam. You find that skills improved beyond just exam preparation. You have thanked us for helping you obtain your HIV diploma. So this one has passed. They set in for their diploma. The sessions were very educational beyond expectations, so which is much appreciated. And you've said that you have significantly improved in terms of your skills, understanding that some don't take the preparatory programs for exams only, but to improve on their skills. You appreciate the sacrifices that our facilitators make on a day-to-day basis to facilitate these diploma preparatory programs, and that you appreciate our clinicians who are more confident, and that you have become one yourself. You are now a better clinician and you are more confident in your field of work. And another participant said they wrote the exam before, didn't go well. They came back. As I mentioned, continuation programs are available. They rewrote, and this time around it was with much ease. They actually passed the exam. And then we have this one, which we'd like to also appreciate the love you've poured out, that you've shared with us. In your words, you said, "We love you. Thank you so much. Please keep doing what you are doing for the community." So this goes to the CCP team, our facilitators, our participants, and everyone who registered for the preparatory programs. This wouldn't be made possible if you hadn't taken us. So appreciate that. Then we move on to the next slide. Then moving forward, we move together, and this is our commitment to you. We will maintain the quality of work that we have put out there. The percentage, 67% excellence, we are improving on that. Next cohorts, we want 100% review in terms of introducing or inviting through experts in the fields of the diploma preparatory programs that we offer. It continues to be evidence-based content, interactive in terms of the learning, live coaching sessions that we host, the mock exams that we'll be conducting, polls on the WhatsApp groups and various platforms, and also ensuring that it's clinically relevant to your field, and improvements that we have implemented and are implementing, time management and enhancement in terms of the content or materials that we offer, exam focused alignment, and also support in terms of responding to you on a timely basis. And as you can understand, our experts are also juggling a lot of projects in their own time. So they will try by all means to ensure that in terms of responding to your questions on the various support platforms, they are readily available to respond to your questions on time. This is the feedback that we are sharing. And would like to encourage those who have not yet enrolled, and those who did enroll, wrote their exams, but did not necessarily do well, and overall those who did not write, because in total we had 270 enrollments of the 4 diploma preparatory programs that we offered in the previous cohorts. And so this was the percentage of those who actually wrote. Of those who have not yet enrolled, we are encouraging you to join, because the numbers speak for themselves. We had a 93% pass rate amongst those who responded, and satisfaction amongst them set at a 95%. Our instructors are experts in the field. They provide real life examples, guidance, and assistance. Our offering, our content is comprehensive in terms of the preparation for exams, and available programs now, taking into consideration the feedback that you shared. Currently, cohorts that are all available and open for you to register: Diploma in Child Health Preparatory Program. If you want to sit in for the OBS preparatory program or diploma, it's open. Internal Medicine Diploma Preparatory Program is open. Diploma in HIV, the preparatory program is also open. Diploma in Anesthesiology, this is a new offering. The Diploma in Ophthalmology, the offering is also new to the platform. Registrations are open. To register and join us for the live coachings. as they shall begin next week. We are also working on offering or bringing more programs. They'll be coming soon. So stay tuned and stay with us. You can do that by keeping in touch with us. On the next slide, we will share with you. So we do appreciate the 20 members who have volunteered. We will be reaching out to you for your testimonies and we will share them. And your stories will definitely inspire others. And we always appreciate you. So please do keep in touch with us and also register. Registration fee for the offerings are put there. Contact me and also visit our website to learn more about them and coaching sessions will be beginning. Also visit our website to learn more or contact us via WhatsApp or call so that we can assist you. And next we'll be sharing our contact information so that you can be able to reach us. Please also like and follow us on our social media platforms so you can get notifications of upcoming events, activities, and everything that we are doing to empower you clinicians, quotes that we share just to lift up your spirits and your mood based on the theme of the month. October is Breast Cancer Awareness Month. Do follow us on our social media platforms. We will be sharing resources that talk to that, and also we'll be supporting you to ensure that your patient care is improved on a day-to-day basis. We'd like for you to follow, like, and comment on our posts and invite others to also follow us. These are the current social media handles and platforms that we are available on. And our website is always up with our content and courses that we upload on a daily basis. We are available on call or WhatsApp on the number on screen 0645433928. Our email address is info@clinicalcareplatform.com. So these are our handles and contact information for you to reach us at any given point. Lastly, would like to say thank you so much to our presenters, facilitators who have taken their time to participate in the diploma offerings. To those who have registered for the preparatory programs, we appreciate you and we thank you. And we are striving for excellence beyond the percentage that we got now. And we also wish everyone who has enrolled and those who are yet to enroll when they then sit for their exams, very good luck and an enjoyment during their lessons and coaching sessions that are about to take place. Thank you so much and have a blessed evening. We'll be moving through to the Q&A. Over to you, Miss Monedi. Thank you.
Thank you. Thank you so much, Imelda. Thank you for a smooth feedback and for making sure that everything is covered. Thank you so much. Up next, we will be moving to the Q&A, and yeah, we will be doing this as a team. So the first question is from Anonymous. How can I get, Anonymous is asking how can they get a reference letter if they're working in a district hospital and wants to do a diploma in obstetrics. Team CCP.
Hi, Ria.
Hi, Dr. Mawala.
Yes, I can help with that. But I think before we take the questions, I would love to hear from some of the instructors who are here, just to hear their views. I mean, they've had the feedback from the audience. Not all of them are here, but I think it would be nice if we can just have that quick discussion and then we can go through the questions maybe in a few minutes. Brother Ryan. Hey, where are you?
Hey, Brother Mawela.
What's cooking there?
No,
Are you
I'm
good?
relaxing and
You see, when I see blue attire, I'm thinking, hey.
PCP is cooking.
No, I was looking at the blue
You know,
attire. I'm thinking you
I
have
didn't
a
know you.
drip. I thought you have a drip there. I'm like, hey, what's going on? No, it's
You know,
good.
I didn't know you were gonna put me on video.
Me too. I'm shocked to be on video. The feedback, I mean,
Yeah.
we have seen what our colleagues say. They love what we do, but they've also given us a couple of things they would love us to work on. I don't know what's your overall comments. Yeah, just general. Yeah.
Yeah, no, thank you so much for this feedback session, brother. It's
Yeah.
always good to have quality assurance. We do this in hospital. It's good to do this on the platform as well,
Yeah.
because we don't know our blind spots.
Yes.
And I thank you so much to everybody who has submitted feedback. We really appreciate it. And whereas there's been a lot of success, there's also much room to improve.
Yeah.
And so far, the success rate is quite good, and that's reassuring. And we can only grow in leaps and bounds. So thank you for that constructive criticism, for that feedback. Much appreciated. We strive to offer a better service for everybody. God bless you.
Awesome.
Thank you, brother.
Thank you, Billy. I know you are with the participants there. If it was a room, you'll be seated at the back seat. At least you can unmute, even if we don't see you. I don't know your comments after the survey. Any comment you want to have?
No, I think I would like to, appreciate the platform for the excellent work. It's always nice to sit back, reflect, and, hear what I would say the customer says, because only then can we improve and do better.
Yeah.
So, yeah, it's really, really appreciated. And it's good to get this feedback because then we know what to do, to make it better for the subsequent groups. So, yeah, thanks. I think this is really empowering to us. And so looking forward to the next sessions that are about to start in a week or so.
Awesome. Yeah, we want to embed this feedback as we go forward. Poneli, I don't know if you guys are in a safe space to make a short comment. Mpo, are you safe to say something?
Can you hear me?
Yes, loud and clear.
Oh, okay. I must say as well, I did appreciate being part of this presentation. It made me, as I'm speaking to you, I'm also looking through the slides for the presentation that I'll be doing tomorrow, which will be our first day of anesthesia. So it's good to know what is it that people would like us to present, where we can improve on coming on as well, and how we can do it a little bit different. Gave me quite a lot of insight and a bit of direction on how to do it. And I see people want the content. I try sometimes not to put a lot of information because people get bored with presentations. But I guess this is a little bit different from just doing presentations. They do want to use them later when they refer back and they are studying. So I have put that into consideration. So, but thank you to those who have gone before us. Thank you for having started this. It does give a lot of encouragement because we do want to improve our doctors out there. We do want to add to, because we don't only just improve, we also become better as we teach others. So yeah, thank you for this platform. It really does make quite a difference to everyone who becomes part of it.
Thank you. Thank you so much, Mpo. I know Nelly is on the move. Hi, Dr. Nelly. Are you able to say something? I know you're on the move. On the move. If not, it's still okay. Give me a sign. All right, I think she will come through. She did write to me that she's walking about, probably still at the hospital. But yeah, the reason why I thought it's important, colleagues, to do it that way is because these are our instructors. You can see that they are also committed to listen and to take the feedback and to use it so that the next cohorts, we move better and better. For example, for the child health, one key thing is is because we want people to pass, so we tend to focus on the first exam, which is theoretical, and then when people pass, they're like, hey, now I need help with the OSCEs, and we're like, oh, OSCE, we thought, if we give you good theory, you'll be okay. So there's going to be a lot of support. Also, they change a bit in how the programs are designed so that we are able to take into account the practical side and many other things. I think before I go through the some of the things that are on the chat, I wanted to reply to key things. Number one, in terms of CPDs, in the previous cohort, we decided that every session you attend, you will get CPDs because it was very difficult for us to monitor like total attendance and give everyone the same CPD. So there are two separate things. Every live session you attend, you get your CPDs with a certificate for that session. At the end of the program, when you do your mock exam and you pass it, you will get your completion certificate for the program. But it won't have CPDs. You get CPDs as you attend. If you attend all the sessions live, you will then get all your CPDs. And then the slides, we will see what we can do, but because it's a lot of work that colleagues put in there, we make them available to you on the platform. You log in, you review, you can revise. Seems people want to download them. That's the issue, but all the other guidelines, resources relevant for each session would be made available. They were already available for downloads. Someone was asking about discounts. So we sat and we discussed, to say we've been running these programs for a number of years. Do we need to be increasing the prices or things like that? And as a team, we felt no, there's no, we didn't have the motivation to say, yes, things are going up, and maybe also cost to run a 3 months program. These are going cost for some of the programs. Let's say DCH, there's almost 20 specialists whom we have coordinated to come and coach, especially in the first intake. I think the HIV one is also similar but not as intense as DCH in terms of the people who participate there. So with the decision was that we are not going to be increasing the prices, but we would rather limit discounts and increase the value that you get when you get into these programs. And then there's and then I saw someone saying Dr. Valerie, and that made me to say, Imelda is giving feedback based on what colleagues typed, but there's so many great doctors, specialists who come in to teach. Dr. Dlamini on TB, she goes to the child health, she comes to the HIV program, talking about TB. I also teach in internal medicine on the HIV. There's Dr. Leon, there's Dr. Christy Jackson. The HIV guys know there's Dr. Lauren, who comes in towards the end to cover most of the infections, whether it's tuberculosis, TB, syphilis, and stuff. So really, if we were to say it, they are all very, very important. But she was just giving feedback based on what you type. So if there's an instructor that you wanted us to mention, you were supposed to type in the feedback. You see, if you didn't type, we can't change the feedback, right? And then I wanted to talk to Imelda spoke about the continuation. So just to note that if you register for any of the programs, you'll have access to the materials for at least 12 months, actually for a maximum of 12 months. But when we do the next cohort, you may not join the live session. So if you want to join the live sessions, because each cohort is different, like you'll see with child health, we are now going to be focusing more on a systems approach, gastrointestinal system, CNS, and so on, because the child health community sort of topics, we covered them in the previous one. They are likely to be made self-paced, but we focus more on the system. So you might find that you want to join the next cohort, and that's where the continuation fee comes in. It's 1,000 rands, and then you'll join all the live sessions for the next cohort. So, and how you do that, send us an email, info@clinicalcareplatform.com. Polelo or Ria, if you can just type the email there for the colleagues so that they can just copy it, and then you can join any, whether it's HIV, but you can only join for not for the new ones. There's no continuation for anesthesia or ophthalmology. And then and then let me go through some of the key questions which I saw colleagues raising. Let me start with this one. Maybe let me remove my lower banner there. How can I get reference letter? So we're gonna send out communication. So firstly, Anonymous, if it's urgent for you, send us an email, info@clinicalcareplatform.com. But generally, there's a specific information that we need. So I'll ask the team maybe to Imelda. Actually, Ria is the one responsible for the letters, but she will work with Imelda there. That tomorrow morning they will send out communication to say, send us an email if you want your recommendation letter, and this is the information that is needed. There's your professional history, certificates, and many other things, so that we write a proper a letter. It's not a generic letter for all. It must be specific to you, where you work, how long you have worked, the hours, to encourage the college to consider you. And I want to say two things as well. We encourage you to talk to your immediate line manager to write you a recommendation letter. Our letter does not replace the letter from the line manager. And the second thing, which is important, is that we do not have control over CMSA admission processes. To be honest, so far we haven't had issues, but I always want to make sure that you understand that we are not CMSA. We encourage people to write those exams, and we have an understanding with the CMSA. We have had meetings with them, and so far so good. But you still have to do your part in terms of giving us the information, etc. Let me move to the next one. Dr. Ryan, you want the horn? Poo, 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 poo. Yes, Udirile. That's why
Yeah, bro.
I'll play it at the end. Udirile says we forgot Dr. Valerie. Actually, she's teaching on Monday. She's the one who's going to be taking us through the first session in obstetrics. She's a valuable member of the team. It's just that when we read the feedback, participants highlighted few people, so it's fine. But we know that we have a huge team behind these programs, and I mean, her experience and the way she teaches obstetrics is awesome. You're gonna have fun. Those who are going for obstetrics. Omutunde is asking about the 500. Yeah, it didn't make financial sense, and we had to review how we do that, and also considering that we want to keep the actual price fixed in the next few years, and I think we can only do it if we add value to you, but there's also value to our instructors and ourselves. And if you look at it, if I give an example with the HIV diploma, it's a 3 months program. But if you look at the coaching that's there, you look at some of the courses that we make available self-paced, you will see that there's great value for people who come in. Ke Khomoditswe. Yes, what a beautiful name. Can you please give me information regarding continuation program? So continuation is not a program, but it means you were registered, let's say for obstetrics, and you want to join again. There's people who join in the HIV diploma. I can tell you, we are now going for the 7th cohort. And there's Lesotho Mawela, since the first cohort, he joins. Why? Because the content is dynamic, there is depth, and some people just want to be on top of their game, and remember, if you have committed to grow, you'll always want to grow. So we welcome those, and they just pay the continuation fees, not 5,000 rands every year. They've paid the first 5,000, but every year he just says 1,000, and they continue and stuff. So I think we appreciate people who want to get better. Yes, so to get the motivation letter, if it's urgent, send us an email. But tomorrow, the team will share in the groups there the minimum information required for us to write you a proper a letter. It's a lot of work for the team when we write the letters. Okay, Rea, are you ready? And I know you are writing exams this time around. So we will see. Kutazo, I saw that you registered this morning, and I know that I have sent an email this afternoon. Just check your emails. Otherwise, the team will follow up with you. But thank you for trusting us and making that call this morning to join the diploma in ophthalmology. We were not sure, I told Dr. Mufeke, oh, the eye. I don't know if there's doctors who love the eye. So we are so happy to see a very positive response for the new programs. Even anesthesia, I think it's going to do well. Dr. Mpo and Nelly. Let's see what we are saying here. Thank you for the amazing work you do. How do I get the recommendation letter? I think I've addressed that. Send us an email for now, but tomorrow we will send out what information is needed. I work at clinics and just registered yesterday. Thank you for trusting us with your professional development. Oko HIV, you can't go wrong. We are going for the 7th one. We know exactly how to pass. Do I have to do the HIV courses before I can be? I would recommend it, because if in the recommendation letter there's no like there's no course, it's gonna be difficult for CMSA to. I must be honest. You see, I'm being very honest with you. So, and at the basic and advanced HIV, if you don't have time, at least do the advanced and the updated guidelines. I think they'll give you about 40 CPDs between the two. But an empty recommend, even it must have weight, and we are trying to give you the weight with those courses. I hope you understand. Is it possible to register for two people? That's what people are doing, and let me show you how they do it. We have many.
Lost your audio, brother.
I wanted to say, because I'm responding to, it's anonymous again. So let me see if it's possible to put it here, because it's you won't see it. Oh yeah, there. You see, anonymous is saying, is it possible to register for two? So we do have a couple of people who register for more than one diploma, and all they want is this schedule. Because, for example, if you look at the live sessions for the HIV program, they are on Wednesdays. That means you can still do HIV and internal medicine. But what we have done, which in the previous cohort we didn't do, Dr. Ryan would know that I would have him coaching and I'll be in the child health program. You see, even when we have two sessions, ophthalmology, luckily, Dr. Mufokeng is able to start earlier. It's only on Fridays. If you want to do ophthalmology and internal medicine, I think you might have a problem, right? But you could do HIV with many other programs, for example. So we've been circulating this in the groups, and we will send it to everyone again. Just look at it, and then if you want to make sure that there are no obvious clashes. But remember, if you miss something, you still have self-paced, but you must attend some sessions live. I don't know. And then also pay attention to the actual start date. Today's the first. We are launching these programs. You heard Mpo saying she's preparing. Tomorrow she's teaching, because it's this thing, and then everyone else is going to start. So from next week until next year, end of January, early Feb, guys, we're gonna be with you. So if you see the time, I think you'll see the value. And if you understand who is teaching, these are hectically busy specialists. So we really, really want to appreciate them for making time. Kwanele says, I would like to appreciate. Oh, it's a. I thought it's a question. I would like to appreciate the platform for all the educational activities it provides. It makes such a difference to patient care and knowledge base. The content is always of great quality. The internal medicine preparatory program is outstanding. Brother Ryan, whoop whoop whoop. Maybe I should give you the horn. Where is it? Kwanele is very happy. So we are happy when colleagues are happy, because we are here for them. Are you good, Brother Ryan? Okay, we'll come back to you.
Amen.
Amen. Yes. Odirile says, okay, Doc, I don't understand continuation phase. Please, me. Yeah. So the challenge, Odirile, is that, you see, with the DCH, that's why I took so long to respond, because basically the coaching program started and ended, right? And the people passed, and now they're going for the OSCE, and we do not have an OSCE preparation program, for most of our programs. So what we have done is that with the second cohort, we are going to integrate the OSCE preparation and whatever else they need. So my recommendation is that if you are going for the OSCEs in November and maybe you want to cover some ground, because I think by November we would have covered, I'll tell you now, we would have covered gastroenterology, we would have covered respiratory system, we would have covered there's a very experienced clinician, and I'll ask him if he can do the problem is these specialists, hey, the time is a challenge. So most of them they can do one, especially for child health. We have one person coming in to do that. Or cardiology. I think the second week we're gonna do cardiology and other things. So if you are going for the OSCEs, I would encourage you to just pay the continuation fee, join the second cohort, get as much as you can for the first 5-6 weeks of the program, because it's gonna be OSCE. The training approach is totally different from what we did in cohort one. And why is it different? Is because of the feedback that you gave us. So yeah. But please write to me directly, and then let's see how we can help. I know that most of you are going for the OSCEs, and you need support for that. And yeah. That is how it's going to run. But generally the continuation fee applies to all diploma programs, basically. Doctor, sorry I joined late. Is ophthalmology session? No. So ophthalmology starts next week, Wednesday. So you can see there, starts on the 8th. Ophthalmology, ne? Chitale starts on the 8th, Wednesdays and Fridays. And we are trying to not change the schedule so that even when you plan for your calls, you know Wednesdays, Fridays, Wednesdays, Fridays, Wednesdays, Fridays. If you miss a session, you'll get access to the recordings. If we have to make an adjustment, because there's always emergencies time and again, you will know way in time that a certain session is not going to go, or we are switching to an alternate time for a specific session. And then you'll get all the timetables with the topics, and you will know which topics are covered which week, which day, etc. But in the information sessions, because we've had now information sessions for all the diplomas, the schedules were shared there. So we are just going to take them, put them nice, and then send them to you. Get that says I'm always attending. I know that you see. So I was not wrong. I know there's like 10 people. I can tell you every year they are there, and they know that there's always new things. We also cover important updates. So continuation is not just because you are writing the OSCE. It might be because it's a field that you love and you want to get better at it. There's so many questions. Okay, let's go. Kwanele is back. I would also like to ask that maybe, Dr. Ryan, are you still there? I hope he's still there, because that's his piece of cake. Okay, he's gone. But I will share with him, because we were discussing how the FCP is going to run. We are aware that there's an exam in January or something next year, and we don't have enough time to run the live sessions the way they need to run. So we will see. This would make it much more accessible on call schedules. It would help in post diploma learning, regardless of whether one is a red post. Okay, you would like FCP master would be bundled into one fee, sort of like a diploma preparatory program. The challenge is we rely on the same instructors. Like now, you see, we were discussing the diplomas are starting, and FCP exams are in January. So we don't know how to do it. And Dr. Ryan is working on part one content, which will be self-paced. So Kwanele, I hear you. Just be patient, and then let's see how we can handle this one. Ria, can you take a snapshot or anyone from CCP, if you can take a snapshot of this question. I'm sure it's not that clear on your screens. Let me see if there's a way I can also try. I want to, because we were discussing this with Dr. Ryan and we haven't figured out. I said to him yesterday, let me sleep on it and see what creative way we can bring it. We are aware that there's people who are writing and we don't know. Maybe we'll just make self-paced. Yeah. Sorry to ask on it, but we will be having hematology preparation for primaries. Oh, you mean for hematology as a discipline? Yeah. Hey, hey, you guys are pulling. You are pulling from CCP. All right, I hear you. I hear you. We have a lot of demands for psychiatry, emergency medicine, part one for surgery. Yeah, we are getting there. At this point, I'm not able to say yes. I think, yeah, at this point, no. At this point, no. But we will note it and see how we can pull it off going forward. Yeah, so, oh, that was Brother Ryan wishing us well. Thanks for the session, everyone. I gotta run. Bless you. Yes, brother. Blessings, blessings. Colleagues, are you good? I really tried to go through all the questions. I hope we have managed to cover the key things. You have an idea of what's happening, where we come from, where we are going, and that this is an incredible journey which we cannot do on our own as the platform. We need you, we need our instructors, and we need many other people as well to keep these things going. Ria, I took over because I wanted to quickly go on these. I think the questions were too many and also to get inputs from the instructors. Can I hand over to you to officially close and then we call it a night? If you are...
Thank you.
Yes, thank you.
Thank you so much,
And
Dr.
we want
Mawela.
to see you. Don't like picking people in the dark. Where are you there? Are you or you are
Yes,
you
I'm
are now
here.
cooking? Are you now cooking?
No, I'm still here.
All right, yeah, let's close. Yeah. Thank you.
Thank you so much. Thank you, Dr. Mawela. Thank you, Imelda. Thank you, Tim. And thank you, colleagues, for joining us. It was a wonderful session. Thank you. See you next time. And have a wonderful evening. Good night. God bless.
Hi everyone, I'm Dr. Shaole, currently working at Rofera Hospital in Mpumalanga Province, currently working in the Department of Anesthesia. I'm here to tell you about a new program that will be starting in October for a period of 12 weeks that will be running twice a week at 8 o'clock. We will be running a coaching program in order to help you to acquire a diploma in anesthesia and be able to write the diploma and be able to pass it. The reason why we're starting this program is that there has been quite a high demand from you guys through clinical platform. We are hoping to help you in being competent and being able to confidently sit for your exam and being able to improve your skills and being able to give your patients safe and good anesthesia. We hope that you are excited as we are to start this program. We hope that we can help you feel confident and feel ready to sit and write with the College of Medicine. We will be running this program. I will be doing it with my colleague, Dr. Mahlamela. She also works at Rofera Hospital, and we have come together to try and help you in eventually acquiring your skills or your knowledge and successfully passing your diploma in anesthesia. We're very excited. We hope you're also excited that we have decided to start this program. We hope to see you and we hope to grow and learn together. Bye.
Hi, I'm Billy Magagula. I'm an obstetrician and gynecologist in Nelspruit. I'm responsible for the Diploma in Obstetrics Preparatory course. We run this course with other colleagues who will come in as speakers during the course of the training. We run this course over a period of 3 months with meetings at least once a week. where we will teach, guide, and help you prepare for the exam, but also share a lot of skills that you use on a daily basis. Not only will this course help you to pass your exam, but it will give you a lot of knowledge and a lot of skills and a lot of confidence, which will not only benefit you, but will also have a positive impact in your daily clinical practice.
Hi colleagues, my name is Dr. Tabiso Mofokeng. I'm a specialist ophthalmologist based in Central, Morningside. I'm excited to be involved as one of the coaches for the candidates who want to prepare themselves to sit down for the Diploma in Ophthalmology in the first semester of 2026. I'll be doing this in collaboration with Clinical Care Platform. So, my qualifications, I did an MPCHB at University of Natal many years ago. And then I was a general practitioner in the East Rand for at least 18 to 14 years before I went back to specialize. I did a diploma in ophthalmology, and I also did my primaries 1A and 1B while I was still a medical officer at a small hospital. Once I got the registrar post, I sat for my fellowship exam in ophthalmology, and I also did an MMed at VET in ophthalmology. I am more than excited to be of great support, and especially when it comes to advising and giving you tips on how to prepare for these exams. Thank you.
Hello everybody, Dr. Ryan here, specialist physician. Thank you so much for joining me even as we tackle Diploma in Internal Medicine. All right, and it's my joy and privilege to be hosting this on the Clinical Care Platform, and let's get into it. Why do you want to do the Diploma in Internal Medicine in the first place? Well, the purpose of this diploma is to encourage postgraduate training in the beautiful discipline of internal medicine. It's intended for medical officers wherever you are, be it teaching, non-teaching hospitals, designed to improve your competence and ability and your competence in evaluating and managing common medical disorders, leading to improved outcomes, improved medical care wherever you are. What are the requirements for admission? Well, you got to be registered with the Health Professions Council as an independent practitioner. You should at least have undertaken between 6 months to a year of full-time in-service training in a department of medicine which is accredited by the college. Who can apply? Absolutely anybody, not just those who are intending to write the exam, but if you just want to sharpen your skills in internal medicine, this program is for you, and especially you, medical officers, general practitioners, registrars, conserve officers, interns, everybody, even physician assistants are welcome. The weighting of theory papers as per discipline, okay, this is taken from the blueprints of the diploma program or the diploma exam. Cardiology, emergency medicine, endocrinology, metabolism, infectious disease, nephrology, pharmacology, pulmonology, GI, geriatrics and nutrition, hem-onc, neurology, and rheumatology. And of course, we have some OSCE questions as well that we're looking at. Lots of data interpretation, guys, ECGs, chest x-rays, blood gases, labs, you name it. The course is structured over 20 sessions. When do these sessions happen? I'm glad you asked. Well, it happens on twice a week, usually on a Tuesday and a Friday evening. The Tuesday session is usually between 8 to 10 p.m. and the Friday session between 6:30 and 8:30 at night. Alrighty, it's designed to be high yield, system-based, CPD accredited, all based on past year questions, and equip you not just with the information that you need in terms of the theory, but also an approach to tackling questions, looking at past year questions and basing our discussion around these. We'll also incorporate relevant OSCE questions and different investigations. So 22 sessions give and take, okay, including one that's geared towards preparation for your clinical exam, all right? But remember that the format of the exam is 2 theory, 1 OSCE, and if you pass that, you'll be invited for a clinical, okay? So we go through one session just preparing you for that clinical. We include 2 workshops in here. These workshops are highly intense master classes running on a Saturday, one based on chest x-ray, one based on ECG interpretation, the dates to be announced. An example of a question that we tackle, you got a 40-year-old female comes to you, shortness of breath and echo shows pulmonary hypertension. Give a classification for pulmonary hypertension. We look into the WHO classification. We break each of these groups down, 1, 2, 3, 4, 5, and also got a variety of different cartoons and visual aids and acronyms and mnemonics which aid you in your learning experience. So the coaching program is designed to be high yield, comprehensive, engaging and interactive, effective in preparing you not just for the diploma exam, but for taking care of real patients in real life. And of course, I got my dad jokes. We'll be closing this off with a dad joke. Why do the Backstreet Boys make such bad cardiologists? Well, because they'll tell you it's ain't nothing but a heartache. Tell me why. Well, I just told you why you should enroll in the coaching program, Diploma in Internal Medicine, via the Clinical Care platform. I hope to see you there. Take care and God bless.